She is a risk management consultant with Antum Risk, and she's my counterpart in the FLIP program. She joined us back in July, so we're so excited that she can be here and give some additional information on standards that apply to you all.
Thank you. So what I'm going to be speaking to you about is the regulation for vaccinations for healthcare workers, and this is from the CMS regulation. So if you participate in Medicare and Medicaid programs, this is going to apply to you. Everything OSHA is out the window, unless they're unvaccinated, okay? So hopefully this will be, I shouldn't take up too much of your time. You can finish your lunch, all that good stuff. Before I get started, I do want to say earlier this week, Governor McMaster and the Attorney General have decided that they are going to challenge this regulation. So as updates come out with that, I will be sure to send them your way. Okay. Oh, wrong one.
Is it going?
There we go. All right. So like I said, this regulation applies to all the facilities that participate in Medicare and Medicaid programs. All of your staff must be fully vaccinated against COVID-19. There are going to be two phases of the regulations, very similar to OSHA, and this regulation does allow for exemptions, which we will get into a little bit. So these are all the included facilities. Basically, bottom line that CMS said is, again, if your facility participates in Medicare and Medicaid programs and is regulated under the CMS conditions of participation, conditions for coverage, or requirements, then this applies to you and you are expected to abide by it. If you don't, they will take action for it. So once we get into the exemptions and everything, that's when you fall back into OSHA regulations. And again, we'll talk about that in a little bit. So basically, everyone's included. So eligible staff, it is all your current and new staff who provide any care, treatment, or services to the facility and its patients. And kind of as we touched upon before, even if you have a worker that is going into the building, even though they may not have direct patient care contacts, if they are seeing somebody or speaking with somebody that does provide patient care, then they fall under this rule. For example, one of the examples that they gave were if you have an ongoing construction project, that construction crew is going to be using your bathroom, using your cafeteria, they will fall under this rule as well. A good way they put it is any individual who performs duties at any site of care or has contact with anyone at the site of care. Not included individuals who provide services 100% remote. So those staff that do telehealth, that never come onto campus, they do not fall into this category. So the requirements, all the facilities must develop a process and a plan for vaccinating all your eligible staff, providing accommodations for those that qualify for an exemption, and then also tracking and documenting all the vaccinations as well as the exemptions. So I said there's two phases. These are your deadlines that you're going to want to remember. December 5th of this year, you must have developed and implemented all these plans. And then all eligible staff, must have also received either their first dose of a 2-dose series or received a single dose vaccine. That's by December 5th. And then by January 4th, all eligible staff must be completely vaccinated. And you're probably asking, well, what are they defining fully vaccinated as? Per the CDC, fully vaccinated is 14 days after receiving either the single dose Johnson & Johnson vaccine or the second dose of the Pfizer or Moderna. However, if they have received their second dose before that January 4th deadline, they're covered, even though it's within those 14 days. But ideally, we want everybody 14 days. So really they have, I think it's like December 21st or something, is ideally when you would want them to receive their second dose. They can mix and match the multi-dose. So they can get a Pfizer and a Moderna, which I thought was interesting. Yeah. Booster shots do not have anything to do with this. All right, so exemptions. Certain allergies, medical conditions, religious beliefs do qualify for exemption. For those exemptions, you must establish and implement a process that they can request an exemption. You have to have a process for collecting and evaluating those exemptions, the facility's decision, and then the accommodations that you're going to provide that employee. Those are all the notes I had on there. All right, so medical exemptions, there is a lot of documentation required. The documentation must include the recognized clinical contraindications which support the staff's request. So of course we want to make sure that those match. Information specifying which vaccines are contraindicated. So ideally you want the Johnson & Johnson and the Pfizer Moderna, why they can't get those. Statement from the practitioner recommending that the staff member be exempt. And then it must also be signed and dated by the licensed practitioner. For religious exemptions, this falls under Title VII of the Civil Rights Act of 1964, which prohibits employment discrimination based on religion. There's not as much documentation that needs to be done with a religious exemption. If you go to the EEOC website, they have a really good, really in-depth summary, I guess, of how the religious exemptions work, because it is kind of, it's not black and white, kind of like the medical ones are. But the employee needs to notify their employer that there is a conflict between their religious beliefs and the vaccination requirement, and then their employers need to provide them with the information to request that exemption. I've seen a couple people that have just developed a form, and they basically just have to sign off on it, and they say this is against my religious beliefs, XYZ. Again, if you go to that EEOC website, they do a better job of describing it, and I can send that to everybody as well. I think that was mostly it. Janine, I hit the wrong one again. Sorry. Oh, never mind. I didn't. Okay. So that is kind of it. I did print out these slides. I was just going to go over really quick. This was from the CMS presentation that they did. And I know Tamara touched on it a little bit, but vaccination is the only option. Testing is not a part of this. However, if you're putting in that process into place for your exemptions and you want to choose testing as an accommodation that you're going to provide, then that's fine. But it is not, CMS is not saying, yes, you can either get vaccinated or you can get tested. You must be vaccinated or have an exemption. Some of the accommodations they mentioned were if they can be moved to remote work. That's one. If they can social distance at work, again, testing, you can provide that, but CMS isn't choosing that as a option. What questions?
There's one on the screen if you want to go over there and see that.
It says, I'm just curious about masking and approved exemptions. Prior to flu being mandated, employees that refused the vaccine had to wear masks at all times. Does this extend to COVID?
Yes, that would, in my mind, be an accommodation that you would make. Is that, okay, if you're not going to get vaccinated due to a medical condition, again, you can't just say, no, I just don't want to get it. If you have a medical condition, that would be an accommodation that would be provided, was be wearing a mask at all times.
So I have a question. If a team member was COVID positive and they received the monoclonal antibodies, they can't get vaccinated for 90 days. Is that considered part of the medical exemption? Yeah.
I'll have to pull up the actual register, but it did say that staff with the monoclonal antibodies are not exempt from this regulation.
Oh, 90 days. Just for 90 days, though.
Right, so we're saying, you know, you can't get it within 90 days because CDC says you can.
Right.
But you still have to get it. You have to get it. After 90 days.
Yeah. Yeah. Sorry. That was, yeah, no, you still have to get it. You can't be like, oh, well, I have these, so I'm good forever. Yeah. Sorry. Clarify. Thank you for clarifying.
You will apply for that
90 days. Yes. Sorry. For the 90 days. Yes, it applies. Thank you for clarifying. Any other questions? Again, if your government or CMS applies to you, this is what you're following. Okay. Again.
I guess it becomes, so like when you're handling replacement visits, kind of have this discussion coming down here. We're bringing in new hires, they've not had any vaccines. I mean, they've got to have a vaccine on board before they can come to work. You're still not going to be fully vaccinated unless they get the J&J one. I mean, you'll have to monitor and keep up with and police those people to make sure they get that second vaccine. Okay.
I'd have to look at I think there's terminology in there for new staff that they can't even start until they've received that second one. If they're doing the multi-series, yeah. I don't know if it was with you, but I was getting some emails about that. I'll have to do a deeper dive. It was a very long document.
So they can't start until they've had that second vaccine.
I'll clarify on that and get back to you, but I do believe that's what I saw in the literature.
Oh my God, they're crazy.
Yeah, we're not.
Again, don't quote me on that. I probably shouldn't have said anything, but yeah. Or, I mean, yeah, I would say they have to at least have the first one.
Yeah, I think that's what we said.
You set your policy as you gotta have the one before you come. Well, now everybody's found religion.
Oh, sure.
Everybody's found a religion and they don't want to get it. And when we first set our mandate, it was, you gotta have documentation, and then it was, no, you don't have to have documentation. Well, now, I feel like everybody's going to find a religion to use, no, I shouldn't say that, but to use as their crutch to not get a vaccine.
Right.
Um,
I think there's not as much documentation necessarily you need for that one. So you just kind of, that's why that website is really good, because it kind of goes into say like, well, are you allowed to ask them, okay, well, why is it against your religious belief and you're not supposed to? So
that's when you would go back to the OSHA standard, right? For any of those folks who have chosen that exemption, per the OSHA standard, they can be required to provide their own test, and it has to be, yeah. So that's the agreement that they're making by saying, well, it's against my religion to be vaccinated. Well, now you are in our mandatory testing program, which is on your dime and at your time, right? You don't even have to give them time within their day to go and get that. That the OSHA standard makes it appear as though, at least right now until it's thought out, that all of that is the employee's responsibility. The other thing to remember when we're talking about OSHA and CMS and all of that, CMS absolutely trumps when we're talking about these vaccination requirements and all of that kind of stuff, but keep in mind that first OSHA ETS addressed everything but vaccination, almost. I mean, there's a little bit about vaccination in there, but they established a lot of rules for keeping your lists of team members who are COVID positive, even if it's not a work-related COVID positive. I think Sharon mentioned about the 30-day rule no longer applies to hospitalizations when it comes to COVID. So if you have a team member who was hospitalized more than 30 days after the date of exposure, but it was a work-related exposure, you have to let them know. You are still required to report that. Only if it's work-related exposure. The list has to be all cases, but the reportability and recordability are only for work-related cases. Will there be different requirements for existing staff versus new staff?
Perfect.
No, staff at all healthcare facilities at a minimum the first dose of a 2-dose vaccine or a single dose by the deadline or prior to providing any care, treatment, or other services.
So they need at least one before they start working. Yep.
One before they,
Phew. Had to give you all a little excitement for the afternoon.
excitement in the day. Yeah. Excellent.
Thank you for clarifying that and looking it up for me. Now I don't.
Right. Oh, and resources.
Yeah. Yeah, I just want that last one, the what you should know about COVID-19 and ADA and all that. That's the one I was saying about the religious exemption. So I just want to put it up there in case anybody wanted to grab it, but I can send the link out too. It's very, very helpful.
They have a good form.
They do.